Mr. Chair, I'm pleased to stand up and speak to the Alberta Insurance Premiums Healthcare Donor Declaration Amendment Act 2011, and I'm particularly pleased to stand up and speak to the amendments that were tabled in the legislature, I guess, a couple of Mondays ago. I have spoken in this House on many occasions in regards to my support for organ donation, and have made it very, very clear that I'm a huge supporter of organ donation. I think what we have to do is educate the public as much as we can, and as I indicated last time I spoke and ended my speaking notes with a comment that was brought to me when I had brought my original bill forward several years ago. I want to state that the original bill stated it would try to increase the pool of organ donors by making it mandatory for people to answer their organ donor card when they register with Alberta Health and Wellness. And I indicated just briefly I do like the amendments to Bill 201 put forward by the member. I was concerned that vital medical care might be delayed or denied because not answering the organ donor question. And I must make it clear that I have been a strong, strong supporter of organ donation since the 1970s. At that time, Mr. Chair, I underwent testings for blood and tissue type because that's how strongly I believed in it. I still carry the same card, and I'm not even sure they even have them anymore. But at that particular time, when you signed up to be an organ donor, I went through the procedure, so I'm ready to go. Once anything, or if anything happens, they can have any organ they want. Some they might not, but they certainly are more than welcome to have anything. In 1998, I put forward the Human Tissue Donation Procedures Statute Amendment Act, and at that time I had collaborated with the Kidney and Liver Foundations and the Red Cross, as well as the Human Organ Procurement and Exchange Program. And the reason I put this bill forward then is the same reason we're having this discussion today. So when you look at 1998, 2008, that's 13 years. And here we are back in the legislature talking about the same bill, talking about the same importance it is, and quite frankly, the government hasn't done anything. They've had the opportunity since that bill came forward in 1998, and I know the honourable member from Calgary West brought forward another private member bill on organ donation, and it passed in the legislature. And here we are again on the 11th of April 2011 talking about organ donation, and yet again another private member bill that is so important to everybody, and the government hasn't acted on the bill that I brought forward in 1998. I don't imagine they did anything on the bill that had been brought forward by the member from Calgary West, and the situation is tragic. As far as I'm concerned, it's tragic. I can't even imagine how many organs have been lost as we've dicked around and we've talked the talk, but we certainly haven't walked the walk. In my research, I've studied many jurisdictions in the world, and I was amazed at the progress countries like Spain has made. In 3 short years, their donation rates increased 75%. Their reforms were modeled around Europe and the other world. While my Bill 206, which is the one I talked about earlier, the Human Tissue Donation Procedures Statutes Amendment Act, didn't make the consent reforms that they did, but they have made incredible progress. While I understand what Bill 201 is trying to accomplish, and it's a worthy goal, I can't help but feel this is not enough to improve organ donation in Alberta. And I speak from other experiences. As I said, I've had the privilege to chair the Advisory Committee on Organ and Tissue Donation and Transplantations a decade ago. And I find it, again, and I repeat this, and I think it's important to repeat, it's ironic that we're talking about this again in this legislature again. It just saddens me to no end that we're having this conversation again, so maybe this time that the government will decide that they finally are really going to do something about this. The committee that I chaired way back called for a comprehensive legislation to improve organ and tissue donation in Alberta. Sadly, and no fault of the committee and the people that work so hard on this particular committee, and I have to give them tons and tons of credit. The progress has been slow and uneven, and no fault of theirs. I know when I had the privilege of working with people, their dedication that they showed when we were working on this committee was nothing but stellar. And I have to even give, once again, credit to the member who's brought this forward to maybe try and get the government to move on it. The heartbreak for me is that time is critical for those on organ donation lists. I've been advocating for improved organ donation processes for most of my political career, almost 15 years. And yet it just seems like we're moving in what I would consider slow motion, or if I can say even more bluntly, no motion. The challenges of organ donations are similar to those of blood donation. They are necessary for saving lives, but people often have a belief that they won't ever need the service. We need to think ahead because in the middle of a catastrophe, the last thing people think about is a donation. The pain and tragedy of losing a loved one is overwhelming, especially when you're still in shock. Donations can't rely on grieving, vulnerable family members. It's asking simply just too much of them. The shock of earth-shattering news from a doctor is not the most appropriate time for the family to be asked for a donation. This is something that people should plan ahead for. Over 400 people in Alberta wait for organ donation. While half of them will receive the needed transplants, many do not receive theirs on time. As the organs shut down, they must endure the pain, along with the family, of watching their lives slip away. Canada has one of the lowest donation rates in the world. One dying person can have a huge life-saving impact on others. A single donation or a donor can add and can help as many as 80 people. Most people don't realize just how long people wait for donations. Albertans have a shorter wait time than most for kidney transplants, but the wait is still 2.5 years. To get dialysis, while they wait, people usually need to come into the hospital for hours every day or two. Not only is there a human cost, but there is also financial cost waiting. Kidney dialysis costs $60,000 a year. The cost of the transplant, including the medication, is $130,000. When patients are on dialysis for years, the best option is obvious. Getting patients the best care they can get saves everyone pain, and it saves them suffering, and quite frankly, it saves them money. A very simple but overlooked step to improve donation rates is education. Ontario and British Columbia have taken a leadership role by creating donor registration. Government agencies actively promote organ donation, and their results are worth examining. The committee I chaired called for a provincial organ and tissue donation and transplant system. While we have the workings of something great, we're just not quite there yet. The committee also called for a province-wide approach to public and professional education. Our donation system relies on the goodwill of others. Living donations is a serious decision and needs greater support from the government. Alberta took a small step by allowing compensation for living donors so their travel expenses and income loss could be covered up to $5,000. At the federal level, caregivers are entitled to compassionate leave benefits for up to 15 weeks. While 6 patients wait for life-saving donations, our government is waiting for someone else to take the lead. Canadian Blood Services was directed to create a national strategy in 2007, and we're still waiting for the bold leadership on a vital issue. National Organ and Tissue Awareness Week is next week. I had hoped debate of this bill would inspire this government to be able to report to this House that they have taken concrete actions before another donor awareness week passed us by. I'm disappointed that it doesn't seem to be the case in front of us. Ultimately, and I say that, I'm going to be supporting this bill because we all share the goals of increasing organ donation. if this is what this bill will take, once again, and as I said before, I think this is probably, from what I remember, the third time, this is a good news story for Albertan.
The honourable member for Edmonton